Bismillahirrahmanirrahim. Quote of the day, indeed, Allah forgives all sin. Indeed, it is He who is the forgiving, the merciful. Today, the topic of presentation is dynamics of disease transmission. I am Dr. Rabbia Iqbal, PGR Community Medicine, and presenting under the supervision of Professor Dr. Saira Afzal, Dean, Institute of Public Health, Lahore. Learning objectives of today's presentation are the natural history of the disease and spectrum of the disease, chain of transmission, which include agent, host, and environment, differentiate mode of transmission, define the herd immunity and the calculation of the herd immunity threshold, interpretation of epidemic curve and outbreak types, role of or not in predicting epidemic potential, and transmission concept to disease prevention and control strategy. So, first of all, we will discuss the natural history of disease, which include the susceptibility, lead to subclinical disease, and then clinical disease, and either resolution or the death. So, the key concept include biological onset of the disease precede clinical symptom by a variable period. The pre-pathogen period include all the host, agent, environment interaction before disease. Primary prevention targets the susceptibility stage. Secondary prevention targets the clinical phase. Understanding the natural history guide for appropriate point of intervention. So next is the iceberg of the disease. The tip above the water show the clinical or the visible cases, and the hidden part show the subclinical cases. So why the iceberg matter? The most diseases in the community is the subclinical and undetected. Clinical cases represent only the tip, a minority of the true burden. The disease register and routine data under represent the true disease frequency. Carrier and subclinical cases sustain transmission silently. Case fatality and morbidity rate based on visibility cases are biased. Population screen can be detected submerged portion. So this is an example of iceberg showing the celiac disease. The tip of the iceberg is the symptomatic of the celiac disease, whereas the hidden part under the water show the two stages include latent celiac disease, which have the normal villi, and the silent celiac disease, which show the damaged villi. So next is that epidemiological triad, which include agent, host, and environment. So agent include biological, chemical, physical, nutritional, whereas environment includes physical, social, biological, and economics. Um, Hosts include age, sex, genetics, immunity, and behavior. Disease occur when the balance among these three factors disrupted. Next, the characteristics of the agent, which are infectivity, ability to invade and establish infection in a host, which can be measured by the secondary attack rate. Pathogenicity, ability to produce clinical disease in an infected host. Pathogenicity is equal to clinical cases divided by infected person. Virulence is the ability to produce severe disease or death. Case fatality rate is the measure of virulence. Immunogenicity, ability to stimulate protective immune response in the host. Additional agent factors include antigenicity, drug resistance, survival outside the host, and a portal of entry and exit. Next is the transmission of disease, mode of transmission, which is direct transmission and indirect transmission. Direct transmission include touching, kissing, sexual intercourse, spread through droplet, which is the large respiratory droplet greater than 1 meter. Placental from mother to fetus, which is known as a vertical transmission. Blood borne through needle stick and transfusion. Animal bite by spread the rabies and plague. Indirect transmission, vehicle borne contaminated food, water, and fomites. Airborne droplet nuclei remain suspended greater than 1 meter, for example, in TB. Vector-borne include mechanical and biological. Mechanical include fly-carrying cholera, and biological mosquito malaria cycle. Iatrogenic, which is through the medical procedure or devices. Next is the reservoirs of infection. Human reservoir, animal reservoir, and environmental reservoir. Human reservoir, symptomatic patient carrier, healthy, incubatory, convulsion, and chronic. For example, typhoid, Mary, chronic Salmonella typhi carrier. Animal reservoir includes zoonotic diseases like brucellosis. Animal reservoir are cattle and goat. Rabies reservoir are dogs and bats. Plague in rodent. Animal reservoir include soil, which contain Clostridium tetani and histoplasma, water, which contain linguella and vibropulra, and in air aspergillus spore. So the key principle is identify the reservoir is essential for interrupting the disease transmission and designing the control strategies. Next is the carrier state in the disease transmission. So first is the incubatory carrier spreads pathogen before clinical symptom appear. For example, measles infection 4 days before the rash. Convulsion carrier continue to spread pathogen during the recovery. For example, cholera and typhoid. Healthy, the contact carrier never develop disease but harbor and spread pathogen. For example, polio virus 90 to 51 95 of the infection are the subclinical. Chronic carrier, for example, long-term reservoir make carry for year or lifetime. Example, hepatitis B surface antigen carrier. So next is the portal of entry and exit. Portal of exit is the source of infection and the portal of entry to the new host. So in respiratory, the portal of exit is respiratory secretion, droplet, aerosols. For example, in TB, measles, and COVID-19. The portal of entry to the new host through the inhalation through mouth and nose. GIT tract, the exit point is feces, for example, cholera, typhoid, and hepatitis A, whereas the ingestion, contaminated food and water are the portal of entry. Skin and mucosa, the exit point, the portal of exit is skin lesion, exudate, for example, in impetigo and syphilis, whereas the entry occurs through the intact, the broken skin mucous membrane. Genitourinary through the urine, genital secretion, for example, HIV and gonorrhea. Portal of entry is sexual contact and mucous membrane. Blood and parenteral through the exit point is blood, for example, HIV, HPV, and malaria. Transfusion can be occurred through needle, blood transfusion, and arthropoid bites. Placental or perinatal. The portal of exit is maternal blood or birth canal, and the portal of entry to the new host is through transplacental or the during delivery. Next, we'll discuss the incubation period and the generation time. Incubation period is the time from the exposure to the onset of the clinical symptom. Vary by pathogen, dose, and host immunity. During incubation period, host may already be infection in incubatory carrier. Used to set quarantine period, trace contact, and identify exposure window. Generation time at the time between the infection of the primary case and the secondary case. Different from the serial interval onset to the onset. Critical for modeling epidemic spread or not calculation. Shorter generation time foster epidemic growth. For example, diseases like influenza, the incubation period is 1 to 4 days. COVID-19, 2 to 14 days. Next is the basic reproductive number R naught. R naught is the average number of secondary cases generated by one infectious case in a fully susceptible population. So R naught less than one, each case infect less than 1%, epidemic will die out. R naught is equal to 1, endemic equilibrium, disease persistent at a constant level. R naught greater than 1, epidemic potential, disease spread exponentially. Estimated R naught value for the selected cases: measles 12 to 18, polio 5 to 7, COVID-19 2 to 3, influenza 1.2 to 1.4. Next is the herd immunity. Herd immunity, the proportion of the population that must be immune to prevent sustained transmission. Immune individual act as a farewell, protecting susceptible number, for example, infant, immunocompromised. Achieved through natural infection or the vaccination program. A herd immunity threshold is equal to 1 minus 1 divided by R naught multiplied by 100%. So higher the R naught, higher the herd immunity threshold required. Measles approximately 94, COVID-19 60 to 67%. Spatial heterogeneity matter. High density cluster remain vulnerable even if the overall hit is herd immunity threshold achieved. This is the example. Measles R naught is 15 and herd immunity threshold required approximately 93. Polio R naught 6. Hmm, Threshold required 83. COVID-19 2.5. Herd immunity threshold required approximately 60%. Influenza R naught 1.3. The threshold required approximately 23%. Next is the attack rate and secondary attack rate. Attack rate is the number of the new cases divided by the population at risk multiplied by 100. Used especially for the outbreak with the defined exposure, foodborne illness epidemic. Secondary attack rate cases among the contact of primary cases divided by the total susceptible contact multiplied by 100. It measures the infectivity, compare vaccine efficiency within the threshold. So application of attack rate, identify the food vehicle in the foodborne outbreak, compare attack rate among exposed versus unexposed, estimate infectivity of a pathogen in a closed population, evaluate vaccine effectiveness, compare secondary attack rate in a vaccinated versus unvaccinated contact, guide the scope of contact tracing and prophylaxis effort. Next is the epidemic curve, types and interpretation. The common source, the point source, which is a single exposure event, rapid raise, sharp peak, fall within one incubation period. For example, salmonella from the wedding buffet. Common source continuous are the intermittent, ongoing are the rapid exposure, prolonged plateau or the multiple peak. For example, contaminated water supply, propagated, which is person to person, sequential waves, each larger space by one incubation period, slow rise, gradual fall. For example, in measles and COVID-19. How epidemic curve help investigator estimate the likely data and type of exposure, even determine the incubation period and thus likely castic pathogen, assess whether the outbreak is over or ongoing. This is the picture showing the point source, which is the rapid rise, continuous, which show the propagated, continuous, which show the repeated exposure, and this is the propagated and intermittent source. Next is the endemic, epidemic, and pandemic. Endemic is the disease present at a relatively constant expected level within a defined geographic area or population. For example, malaria in sub-Saharan Africa, typhoid in South Asia. Hyper-endemic, persistently high disease incidence exceeding that in the surrounding areas. For example, onchocerciasis in the river valley communities. Epidemic disease occurs clearly in the excess of normal expectancy, may be sudden or the gradual. For example, cholera outbreak, Ebola outbreak, West Africa 2014. Pandemic, a worldwide epidemic affecting large number across the multiple countries or the continent. For example, influenza in 1918, HIV/AIDS, COVID-19 to 2020. Outbreak often used for the localized or the limited epidemic. Two or more linked cases from the same exposure. For example, foodborne illness or the at a restaurant. Next is the host factor in the disease susceptibility and transmission. Include age, extremes of the age, high susceptibility, sex and gender, biological sex affect the immune response, gender influence, occupational behavioral exposure, for example, TB and HIV. Genetic factor like HLA, type G6PD deficiency, sickle cell trait. Nutritional status, malnutrition impair the cell-mediated immunity, increase susceptibility, for example, in measles, TB, diarrheal diseases. Immune status, prior infection, vaccination, passive immunity, immunocompromised are at the high risk. Concurrent disease, comorbidities like diabetes, CKD, alter the susceptibility and severity. Behavior, sexual behavior, drug use, hand hygiene, health seeking, and modifiable determinant of exposure risk. Next is the environmental factor in the disease transmission. Physical environment, climate, temperature, humidity affect the vector breed, pathogen survival. Biological environment include presence of vector like mosquito and ticks, reservoir host, competent microorganism. Social environment include poverty, crowding, conflict, migration, social network, which amplify the transmission and vulnerability. Built environment, wash infrastructure, clean water, sanitation, housing quality, critical for diarrheal diseases and vector control. Occupational exposure, healthcare worker, farmer, miner face unique occupational hazard. Climate change expanding the vector habitat, alter rainfall, extreme event, emerging threat to the disease dynamic globally. Next is how to break the chain of the transmission. Intervention points: eliminate the reservoir, eradicate the eradication program. For example, smallpox, vector control, rodent elimination, treatment of carrier. Block the portal of exit. Isolate the infection cases. Treat open TB, surgical mask for the respiratory condition. Interrupt the transmission by wash, food safety, condom use, sterilization of the instrument, insecticide, treated nest, contact tracing, block portal of entry through gloves, PPE, safe injection practice, mosquito repellent, and prophylaxis. Protect susceptible host, vaccination, chemophylaxis, nutrition, health education, behavior change, communication. So next is the MCQs. MCQs number one: a disease has a high secondary attack rate but low case of fatality rate. Which combination of agent characteristic best explain the pattern? A, high virulence, low infectivity. B, high infectivity, low virulence. C, high pathogenicity, high virulence. D, low infectivity, high pathogenicity. E, low immunogenicity and high virulence. So B is the right option. MCQs number two: an outbreak of gastroenteritis occurred among the attendees of a wedding. Cases rise sharply within 24 hours and decline rapidly after. What is the most likely type of epidemic? A, propagated epidemic. B, continuous common source epidemic. C, point source epidemic. D, intermittent common source epidemic. D, endemic occurrence.
C.
Yes, C is the right. MCQ number three: which of the following best describe the subclinical phase in a natural history of disease? A, period after recovery when immunity develops. B, period after exposure and biological onset. C, period when pathological change but no symptom. D, period when complication develop. E, period of maximum infectivity only.
B. C.
Yes, C is the right option. MCQ number four: a child infected with the measles transmit the virus to other before developing a rash. This is an example of A, convulsion carrier state, B, chronic carrier state, C, healthy carrier state, D, incubatory carrier state, E, mechanical transmission.
D.
Yes, D is the right option. MCQ number five: which of the following intervention primarily target the portal of entry in the chain of transmission? A, isolation of infectious cases. B, chlorination of water. C, use of insecticide treated bed nest. D, vaccination campaign. E, use of glove and PPE.
A.
E is the right option.
E.
Yes, E is the right option. MCQs number six: in a closed population, 10 out of 50 susceptible household contact develop infections after the exposure to an index case, which is the secondary attack rate. A, 10%, B, 20%, C, 25%, D, 50%, E, 80%.
B.
B is the right option. MCQs number seven: a disease with the or not of five would require approximately what level of herd immunity to interrupt the transmission? A, 60%, B, 70%, C, 75%, D, 80%, E, 90%. So D is the right option. MCQs number eight: an epidemic curve shows the successive waves of increasing magnitude, each separated by one incubation period. What does this indicate? A, continuous exposure to the contaminated source. B, point source outbreak. C, propagated transmission. D, zoonotic spillover. E, environmental reservoir exposure.
C.
Yes, C is the right option. MCQ number 9. Which of the following best explain the routine surveillance data underestimate disease burden? A. Low sensitivity of the diagnostic disease test. B. Underreporting of the death only. C. Exclusion of the environmental factor. D. Presence of subclinical and the carrier state. E. High specificity of the case definition.
B.
Yes, D is the right option. MCQ number 10, a malaria control program focus on eliminating mosquito breeding site and insecticide spraying. Which component of the epidemiological triad is primarily being targeted? A, agent, B, host, C, environment, D, reservoir, E, portal of exit.
B.
C, yes, C is the right option. This is the answer key. This is the YouTube channel where the recording of this presentation will be uploaded. Thank you.